Hello everyone, myself Preeti Sharma, Assistant Professor in RKGIT Ghaziabad. So, in the today's session, I will discuss here the general principle of prevention and the control of diabetic mellitus. So, everybody knows what is diabetic mellitus. So, today I will discuss here the prevention, how it diagnose and what are the important points to prevent and control it. So, diabetic mellitus is a group of metabolic disorder in which there are high blood sugar level over a long period, means it is basically a group of metabolic disorder in which there will be a high blood pressure level over a prolonged period. It is known as the diabetic mellitus, and the symptoms we can see the frequent urinations, increase the thirst and increase the hunger. These are some of the symptoms of diabetic mellitus. You can see here level of prevention. These are some level of prevention, how we can prevent the diabetes. So, before coming to the this prevention part, I will tell you what are these types. I will not go brief to the types, but I will tell you the superficial. The diabetes is basically of two types, type 1 and type 2. Type 1 usually diagnosed in children and the young adults, and type 2 most common form may be diagnosed in the adults, and type 1 basically in the children's. Another one is gestational diabetes, can appear during the pregnancy, high risk for type 2 diabetes. And now we can come to the prevention and the control of diabetes. First one is primordial early childhood, preventing the risk factor, health promotion and lifestyle modification. Means in the first, health modification or we can say the lifestyle modification is required to prevent the diabetic mellitus. In the primary, you can see here before the onset of disease, health promotions and lifestyle modification. Secondary, you can come to the early diagnosis, screening and management. Tertiary, you can for the tertiary means before the severity we can identify the disease and prevent it earlier and prevent the complication and the rehabilitations. Here you can see here that first point I discuss here, that in the primary prevention, weight loss means if we exercise daily, then it should be a reduction in the weight of a person. So, regular physical activity such as walking and by doing the physical work, one of the best way to lose the weight. And now the second is stop the physical activity, stop the smoking, stop tobacco and stop alcohol. These are some of the points. If we avoid this, means if the person will avoid the smoking, stop the tobacco, stop alcohol, then he or she can prevent from the diabetic mellitus. So, 30 minutes physical activity, 30 minutes a day of moderate physical activity along with 5 to 10% weight loss can be seen, and that will reduce the weight 50% in diabetic mellitus. 50% of the weight should be reduced if 30 minutes daily person will do a physical exercise, and eat breakfast daily. This is also an important. Nutritious food should be taken by the person, and be active most days of a week. And we can here see this digest carbohydrate quickly. If we taken a carbohydrate, you can see here, if digest carbohydrate quickly, it release the energy, means by using the proper nutritions, how we can control eat or we can say how we can lower the glycemic level in the body. Here the two graph shows, one is high glycemic and another one is high glycemic. You can see here the high blood sugar upon time. So, high glycemic and it is low glycemic. Digest the carbohydrate quickly, release energy quickly and feel hunger soon, and we eat more. This you can see here the graph how means secondary prevention, we can prevent it by using the proper nutritious. If we eat the proper nutrition, then you can see here the difference, that by eating the proper nutrition and proper diet and exercise daily, we can reduce it and prevent it with the help of this nutritious. And secondary prevention, cholesterol, body mass index and blood glucose monitor. This cholesterol, body mass index and blood glucose monitor. Secondary prevention means early we are detecting that person is suffering from the person having a hypertension, means if early detecting the means you can see here, means early detection of the hypertension symptoms with the help of monitoring the glucose level, or by you can control it here with the help of by using the anti-diabetic drugs or hypoglycemic drugs. Here you can see hypoglycemic agents can be used here: sulfonylurea, meglinotides, bigonides, alpha glucosidase inhibitor and DPP4 inhibitors. Some of the hypoglycemic agents like sulfonylurea, meglinotide, bigonides, alpha glucosidase inhibitors and DPP4 inhibitors. By using these inhibitors and by using this agent, we can control and prevent the diabetic mellitus. Here this is some of the body mass index average in the secondary prevention. I told you that by means we can prevent it if the body mass index is below 18.5, that is underweight, weight status is underweight, and 18.5 to 24.9, it is the range of normal. You can see here the normal range 18.5 to 24.9 and 25 to 29.9, that is overweight. Means the person have to reduce this overweight with the help of physical activity. By doing the physical exercise, he or she can reduce its weight, and 30 to or more than that, the person will comes under the obese. If the body mass here in the table, body mass index, you can see here the range and the weight status. Means below 18.5, that comes under the underweight, and 18.5 to 24.9, it comes under the normal, 25 to 29 it comes under the overweight, 30 and above it comes under the obese. So, to control this diabetic mellitus or to prevent the diabetic mellitus, the person have to change their lifestyle, means lifestyle modification is must, and If then also it is not controlling, then you have to take the hypoglycemic agents, means sulfonylurea, miglinides, bigonides and DPP4 inhibitors. These are some drugs that the person have to use, and primary prevention is also required to prevent it. Regular checkup of this regular physical exercise is must, and we can go to the primary prevention level, means there is primary prevention and secondary prevention to control the diabetic mellitus. In the primary prevention, if the population strategy, there is hardly any scope for this strategy in the IDDM, and high risk strategy, since non-IDDM is linked to lifestyle parameters, person at the risk can be identified and lifestyle can be modified. Secondary preventions, as I told you, in the secondary prevention means the aim of the secondary prevention is to maintain the blood glucose level within the normal limits and monitor the blood glucose level, estimate the hemoglobin of glycosylated hemoglobin, give insight to the blood glucose maintenance. For previous 3 months, self care is required. And tertiary prevention, now we can come to the tertiary prevention. So, regular checkup, medications and diet. In the medication, I told you that sulfonylurea, meglinetide, meglinetide means meglinetide and bigonides. In the for example, drugs like fenformin, metformin, these are some drugs we have to use. Alpha glucosidase inhibitors, DPP4 inhibitors, these are some medications which can prevent the diabetes. And this arthritis, heart disease, foot disease, skin infection and glaucoma, we can by here in the tertiary prevention also you can see here that regular checkup, medications and diet is one of the most important parameter in the tertiary preventions. And here you can see the rehabilitation. Rehabilitations means we have to restore the normal health, or we can say the normal health. If the person is restoring the energy and the normal health, it means we by giving a training, that is comes under the rehabilitations, restoring the health. Rehabilitations in diabetic patient has two aspects, prevention and the physical rehabilitations, means we are maintaining and restoring that health by preventing it or by doing the physical activity. So, next we come to the management. Initial sign of this diabetic, we can say how we can manage it, the diabetic mellitus, by the mood change, decrease spontaneity, hunger and the weakness, followed by sweating, incoherence, tachycardia, result in unconsciousness, hypotension, hypothermia, seizure, coma, even death, and 50 gram of fast acting oral carbohydrate, measured blood sugar, loss of consciousness 25 to 30 ml, 50% dextrose solution IV over 3-minute period, and glucagon 1 mg. Means this is the signs which can be seen, initial signs by managing the diabetic mellitus: mood change, decrease spontaneity, hunger and weakness, followed by the sweating, incoherence, tachycardia, and there is result in unconsciousness, hypotension, hypothermia, seizure, coma, even the death. And loss of consciousness 25 to 30 ml 50% dextrose solution IV over 30 minutes period, and you can use the glucagon 1 mg. Now, here some of the other severe hyperglycemia, prolonged onset in ketoacidosis may develop with nausea and the vomiting, abdominal pain and acetone odor, difficult to different hypoglycemia and hyperglycemia. Hypoglycemic agent, as I told you, different you can use hypoglycemic agent like sulfonylurea, bigonides and meglitide, DPP4 inhibitors, alpha glucosinidase inhibitor. Hyperglycemia needs medical intervention and insulin administration. While emergency, give glucose first, and small amount is unlikely to cause significant harm. You can see here that again I am repeating the prevention and the how we can control the diabetic mellitus. So, diabetic, first of all have to clear with the diabetes. Diabetes is as I told you that there will be a group of metabolic disease characteristics by the hyperglycemia resulting with the defect in the insulin secretion, insulin action or both. As all knows that insulin is basically a hormone, it is produced by the pancreas and the body breaks down the food into glucose that our cells use for the energy. It is a hormone produced by the pancreas. Insulin is basically a hormone produced by our pancreas, and the body will break down the food into glucose, and that glucose is utilized by our cell for the energy. So, insulin secretion in the diabetic mellitus, in this disorder, a group of metabolic disease characteristics by the hyperglycemia means there will be a defect in the insulin secretion. If this insulin as I told you, it is a hormone, is not released from the pancreas, means the food which is converting the glucose and that glucose is taken up by this cell for the energy, that if the insulin will not secrete out from the pancreas, then the glucose which is converted, the food converted the glucose, that glucose is not taken up by the cell for the energy, because the insulin is not secreting. There will be a defect in the insulin secretion and the insulin action, or we can say the both. So, insulin is not secreting out and they will not take the glucose into the cell, and that cell will not further process will not take place and the energy will not given to the body. So, we have to take the first of all we have to focus what is diabetes. So, these all are the I told you this is a thing how the glucose is taken up by the cell, and insulin is produced when we eat in order to help glucose to get into our body cells. So, to prevent this diabetic mellitus, there is some prevention and the management. I told you that primary, secondary and the tertiary preventions, physical activity and physical exercise is required, and the lifestyle modifications by using the appropriate nutritious, and the proper diet should be required to take and some of the hypoglycemic agents, means in the secondary prevention by detecting earlier if this sign, if in the secondary prevention you can have to understand that if secondary prevention, if the person is early detect the symptoms of this diabetic mellitus, then he or she can forward the or continue the treatment, that which type of treatment I have to take. Means if hypoglycemia, if there is a means regular daily person have to self care with the help of doing the physical activity. Hypoglycemic agents like sulfonylurea, meglitide. I am telling you here the hypoglycemic agents and the drugs which should be used by the patients. First one is sulfonylurea, sulfonylurea. First one is sulfonylurea. Second is bigonide, DPP4 inhibitors, DPP4 inhibitors, and the metformin, another one is fenformin, these are some drugs which the person have to take. Sulfonylurea, DPP4 inhibitor, metformin, fenformin, and the bigonides. These are the hypoglycemic agents which have to be taken by the person to prevent the diabetic mellitus. And some of the management sign you can see here. The initial, there will be a change in the mood change, decrease the spontaneity, hunger and the weakness, followed by the sweating, and you can prevent it with the help of by going a regular or we can say once in a month you can go for a checkup. So, you can detect it earlier as soon as possible, and you can go for the treatment, whether you have to take the drugs, means you can go for these hypoglycemic agents, and we can prevent it with the help of this by remembering all these points. Now, these are some of the rehabilitations. I told you rehabilitation, with the help of rehabilitation is also an important point to store the health or the proper by taking proper nutritions and doing the physical exercise. You can rehabilitate the diabetic patient. Has two aspects, both the prevention and the physical rehabilitation. So, these are some prolonged onsets, and ketoacidosis may develop with the help of nausea and vomiting, abdominal pain and acetone odor, difficult to differentiate in the hypoglycemic or hyperglycemic. Hyperglycemia basically needs a medical intervention and insulin administration, small amount that may cause the significant harm. And these are some references which I have taken from the review and research papers. So, you have to remember all this prevention and the control, how we can control the diabetic mellitus. So, thank you for your patience.